Hi, everyone. Just a quick reminder to our panelists, if you would keep your video and yourself on mute until we get to your portion of the webinar, that would be helpful. I want to just thank everyone for joining us today. We really appreciate your time. It looks as though it's just 1 p.m. Eastern time on the dot, so I'm going to get us started. Thank you so much for joining us as we go through this webinar on our launch for the Case for Inclusion 2022, Blazing Trails to Sustainability for Community Disability Services. We're so excited to share the report with you, share our findings, and really wrap through the key top lines from the report today. I'm just going to go through a couple of housekeeping pieces before we get started. Just a reminder that this webinar is being recorded. The recording will be shared with registrants within 2 business days. So if you're sharing a login with someone today, make sure that you do your own independent registration so you'll have access to the recording following our webinar. Use the Q&A feature in the Zoom control panel to ask questions of today's speakers. We'll be having a Q&A portion towards the end where we'll have 15 minutes to answer questions from the audience. So if you do have any of those questions at any time, feel free to put them in the Q&A feature and we'll have them listed for us towards the end of the webinar. Please use the chat feature in the Zoom control panel to connect with event organizers if you're experiencing technical difficulties. Please try to put your questions, if you have them, into the Q&A feature, but certainly use the chat function for other pieces. Closed captioning is available. If you click on the CC icon in the Zoom control panel to see closed captioning, that will be available for you. Again, if you have any questions or technical difficulties, please feel free to connect with us using the chat feature. I'm just going to walk us through today's agenda. We'll have opening remarks with Armando Contreras, President and CEO of United Cerebral Palsy. And then we're really going to follow the format of the report itself. And so you'll see the top pieces from our part 1, our interlude, and part 2. So to start us out, part 1, the scope of the challenges to inclusion for all. I'll be your presenter. My name is Lydia Dawson. I'm ANCOR's Director of Policy, Regulatory, and Legal Analysis. And we'll have guest speaker joining us to talk about the real world impact of those numbers, Colleen Crispino, President and CEO of UCP of Long Island. Then we'll have our interlude, a call for intersectional data. James Garcia, Communications Coordinator at UCP, will be introducing and speaking with guest speaker Robert Espinoza, Vice President of Policy at PHI. Then we'll lead you into part 2, Solutions for a More Sustainable Future. Again, I'll be giving you a presentation of our top lines and recommendations with guest speaker Barry Jardini, Executive Director of California Disability Services Association. Then we'll have a 15-minute audience Q&A, and Barbara Merrill, Chief Executive Officer of ANCOR, will give us our closing remarks and close us out. With that, I'm going to hand it over to Armando for opening remarks.
Thank you, Lydia. Good day, everyone. Welcome to the official release of the 2022 Case for Inclusion. This year's report is titled Blazing Trails to Sustainability for Community Disability Services. For those of you who may not be familiar with the Case for Inclusion, it's been published by United Cerebral Palsy since 2006 and co-published as a very successful joint project of UCP and the ANCOR Foundation since 2018. Speaking of ANCOR, I want to take this time to thank CEO Barbara Merrill and her entire team for our extraordinary collaboration these past 4 years. I also want to thank ANCOR's Director of Communication, Dr. Sean Luchtefeld, for coordinating the report production year in and year out, as well as Lydia Dawson, the 2022 report's primary researcher and writer. Furthermore, I want to extend my gratitude to UCP's communication coordinator, James Garcia, for contributing a special supplemental article to this year's Case for Inclusion that examines the demographic makeup of disability service professionals nationwide, a workforce that is now about 80% female and 60% people of color. And it includes a fast-growing contingent of immigrant workers. In addition, I extend my sincere gratitude to our illustrious steering committee, which includes UCP and ANCOR representatives, Ann Coffey, Colleen Crispino, Ann Hendricks, Barry Jardini, Joe Menjani, and Stan Sabi. And we also want to thank the various researchers across the country for the data they collected that forms the cornerstone of this report. Finally, I want to thank the UCP team members, Anita Porco and Fernanda Morrison, and also ANCOR's Shannon McCracken and Gabrielle Sedor for their hard work in helping to make this report possible. In just a few moments, you'll be treated to a top-line review and discussion of the report's findings and our recommendations for policymakers and elected officials on how to improve the system led by Lydia Dodson, ANCOR's Director of Policy, Regulatory, and Legal Analysis. But before I introduce her, I'd like to share a few thoughts. In many ways, this year's report offers a snapshot of the social and economic upheaval that we've all been living through these past 2 years. In brief, the already dire and longstanding crisis that plagued our nation's direct care workforce. Like other failings in our health system, it was amplified and brought into increased focus by the effects of the pandemic. In some regions of the country, it's fair to say the system is teetering on the brink of collapse. While we shouldn't be surprised, we definitely must not be complacent. Record high job turnover and vacancy rates among DSPs are troubling enough, but we should keep in mind that the hardships faced by this critically important and severely undercompensated workforce are just one side of a long neglected, battle-worn coin. For every DSP working in this industry, there are several people with intellectual and developmental disabilities whose lives and livelihoods depend on them. In my experience, DSPs are among the most dedicated healthcare professionals in the country. Still, that commitment doesn't make them immune to the hardships brought on by low pay, long hours, and the effect of the pandemic that's already taken the lives of nearly 1 million people in the US and millions more around the world. And if all of this isn't enough to bear, now let's consider that this is a field whose makeup is overwhelmingly female and people of color, communities that we know are more likely to face a range of social and economic barriers, including the lack of health insurance and childcare resources, jobs that may not offer paid family medical leave, and insufficient food and housing. As the title of Mr. Garcia's article suggests, it should matter to all of us that most DSPs are women of color, because of their success or failure speaks directly to the success or failure of our society's ability to provide quality care for millions of our fellow Americans with disabilities, and ultimately perhaps for every one of us as well. Even if we imagine to live a good life, and I certainly hope we all do, each of us could one day be a person with a disability. It should go without saying that if that eventuality matters to us, it should also matter to them, and also matter on the workplaces that should be diverse, equitable, and inclusive. At its heart, the case for inclusion exists to make the argument that people with intellectual and developmental disabilities and the disabilities community at large should be acknowledged, seen, heard, and valued as full citizens and contributors to the great American experience. And achieving that goal begins with the commitment to ensuring that we all deserve the opportunity to live the most productive lives we can, whether you are receiving care or providing it. To quote Dr. Baheleen Sweener, an epidemiologist, data scientist, and director of Disability Health Research Center at Johns Hopkins University, who counts depends on who is counted. As Dr. Sweener explains in our report, a lack of equitable data leads to inequitable representation. And making sure that everyone gets counted is a civil and human right that must be part of our country's century-long quest for a more perfect union. Keeping that in mind, I hope that the 2022 case for inclusion can help us bring all of us a step closer to ensuring that everyone counts. Thank you. And now I pass it over to Lydia Dawson of ANCOR.
Thank you so much, Armando. I'm going to bring my PowerPoint slides back up here for just a quick moment. So as we start to look at the report and we start walking through the data findings that we have, it's impossible not to start with acknowledging the state of America's direct support workforce crisis. This must be familiar for many people. Long before the COVID-19 pandemic, we were experiencing a crisis of the workforce. Low reimbursement rates for challenging work left an exodus of direct support professionals from the field. Direct support professionals provide support to individuals with intellectual and developmental disabilities in their homes and in their communities with activities of daily living, communication support, employment support, any type of individualized support that the person may need for full integration in the community and to achieve their desires and goals. Unfortunately, due to those rising costs and low reimbursement rates, direct support professionals have traditionally made for the last few years between $12 and $12.50. That competition with other entry-level industries offering a higher starting pay meant we lost significant amounts of direct support professionals to other industries, making it very difficult for providers to remain offering critical home and community-based services, also demonstrating a huge turnover that we'll look at in more detail in the report. But ANCOR offered a survey to analyze the impact of the COVID-19 pandemic on the direct support workforce crisis and what those later impacts have on the industry as a whole, on the infrastructure of home and community-based services. And I wanted to share some of those top-line findings. Due to the direct support workforce crisis, 77% of community providers are turning away new referrals. 58% of community providers are discontinuing programs and services. And this is a huge statistic to pay attention to because compared to pre-pandemic survey results, this represents a 70.6% increase since the beginning of the pandemic. While we think of the direct support workforce crisis and the shortages in access to staffing as being a high turnover rate and a high vacancy rate, it also represents the ability for providers to stay providing services, that at a certain point, if you don't have staff sufficiency, those programs will close. And I think that's a huge thing that we found with the emergence of the COVID-19 pandemic and its impact on the workforce is that a huge amount of providers just began discontinuing programs and services because they did not have sufficient staff to remain open. 84% of community providers are delaying the launch of new programs and services, and 81% of community providers are struggling to achieve quality standards. As we look at community integration and community inclusion for all people with intellectual and developmental disabilities, these numbers are staggering in terms of moving forward and making sure people have the support they need to meet those goals. So that brings us to the start of the report. Part one, the scope of challenges to inclusion for all, looks at the key findings that we have pulled from the data that's available on metrics that focus on how do we achieve inclusion for all. Before I get started, I just wanted to take a moment to really thank our partners and the organizations collecting data on these key findings that really have made the difference in us being able to have a clear picture of what's happening. So I want to, just to name a few, I wanted to thank the National Core Indicators, the University of Minnesota, the University of Massachusetts at Boston, and our other partners for providing that information. You can go to our website, caseforinclusion.org, and look at more state-specific information, but we'll just review today those top-line findings. Nationally, the average DSP turnover rate in 2020 increased by about 1 percentage point to 43.6%. That may seem, 1 percentage point may not seem significant when you're just looking at those numbers, but vacancy rates for full-time direct support positions increased from 8.5% in 2019 to 12.3% in 2020, which was a roughly 45% increase. We can only have so much turnover, we can only have so much vacancy before those programs closed, as we saw with those top line findings from the direct support workforce crisis. So while the numbers continue to steadily increase, at a certain point, what we're seeing as those numbers level off is the fact that programs are simply just closing rather than enduring higher rates of turnover and vacancy. As of 2018, 16 states in the District of Columbia had closed their last remaining large state-run institutions. And while we can all be thankful for the opportunity for home and community-based services and seeing the closure of large institutions, if we think again to the workforce crisis, we need to have services available that can support people in the homes and in their community. So while we celebrate the closure of large institutions, we must also continue to invest in our home and community-based services to ensure that people can successfully remain in the community and aren't at risk for unnecessary hospitalization or institutionalization as we move forward. 1 in 5, so approximately 21.1% of people with intellectual and developmental disabilities who received employment or day supports were participating in an integrated employment service. Again, the access to community integrated employment is so important for all people to feel value in their community, to demonstrate productivity in their community. It has such incredible significance to our identity and the way we perceive ourselves and the way we fit into our communities. Again, as we consider the workforce crisis through each of these findings, ensuring that we have professionals available to support any kind of employment service or employment that someone may need or want. Transportation becomes a huge issue. Any kind of support someone may need once they're at their job becomes an issue if you're seeing those incredible rates of turnover and vacancy. Lastly, there were 589,940 people on states waiting lists for home and community-based services nationally. Nearly 4 in 5 of those waiting were concentrated in just 5 states. Again, as we consider these astronomically large numbers of people waiting for authorization to seek services, we must always consider also the waiting lists that we don't see. There's these waiting lists for authorization, but there's also waiting lists once people become authorized to access services. Someone may wait on the waiting list for years at a time to be able to receive the opportunity to go seek those services. But if they can't find those services in their community, if they have to travel great distances to find them, if they're only able to partially access them because the workforce shortage means they either can't find the direct support professionals to meet their needs, or the programs and services have simply closed due to insufficient staff, this can create a whole new level to the waiting lists. So we certainly want to look at that top line number of people waiting for authorization and continue to work towards eliminating the waiting lists. We also have to consider what happens when people get off the waiting list and ensuring that they have a smooth transition and opportunity to access those services that they've waited so long for. So with that, I wanted to just stop here and hand it over to Colleen to talk to us about the real world impact of what those top line findings mean for people waiting for services and accessing services.
Thank you, Lydia. Good morning or good afternoon, everyone, depending on where you are in the country. I'm really honored to be here to talk about this really important topic. As Lydia introduced me earlier, I'm the president and CEO of UCP of Long Island in New York. And we have been very hard hit by the staffing crisis. And I just want to take some time to talk about what the impact has been for us as an organization. And I think our field, definitely in New York, but I think it resonates throughout the country. And also, the impact on families and service providers and the DSPs that the direct service professionals that do work for us and have stayed with us and are really committed to doing this kind of work. So with that being said, I do want to say thank you to any of you out there listening that works as a direct support professional in our field. The work that you do is critical. You provide intimate care for people, provide meds, you teach people how to do jobs, you provide them with recreation activities, and you really are the foundation of the field, which is why the workforce crisis is such an important issue for all of us talking about this today. As we saw, the vacancy rates have grown across the country, 45% in the last year. I saw somebody, I think, write in the chat that they've seen higher numbers. I think it depends on where you are in the country, because I would agree that in New York, we've actually had higher numbers. And over probably the past 5 to 10 years, we've seen a decline in our workforce. But I know for us in New York, and especially on Long Island, my organization has seen a 20% decrease in the actual number of full-time equivalent DSPs. And that's really significant for us, in that it means that we have to do more with less, and it's not always easy to do that. And our DSPs continue to work really hard in order for us to be able to, carry out the mission of the organization. So I think when you think about what causes these things, I think when you read the report, you'll see a lot of the underlying issues. Decades of underinvestment. I mean, dollars are, they're always a part of the problem and part of the issue. And different states have devoted different dollars to community-based services. And that's definitely an issue, because the amount of funding determines the amount of reimbursement for staffing, and salaries play a big part in why people choose or don't choose to work or stay in this field. The exacerbation of the pandemic definitely has been an issue. We have seen many staff stay in place and work really hard, even in homes where people have been COVID positive. But we have also lost staff for a whole host of reasons. Their childcare was impacted by the pandemic. They have an elderly parent that lives with them, and they're afraid to bring COVID home to them, or they themselves got sick with COVID during the pandemic. All of those things exacerbated what was already a pretty strained system. The rise of minimum wage has also been an issue, which you would think kind of sounds counterintuitive, but it isn't. I mean, on Long Island, where I am, our minimum wage in our county is now $15 an hour, which I know is higher than a lot of other parts of the country. But in past years, our field has always been able to be $1 or $2 ahead of the fast food industry and the minimum wage. But now that minimum wages have escalated, which is a great thing, we have not kept pace with that increase in salary above minimum wage. So if staff can make a choice to work at Target or at McDonald's, or work at a group home or a day program or in supported employment, if they're not truly committed to the mission of the work that we do, we may choose that instead. And that, I think, has been an issue for us. We have been struggling to compete with the for-profit sector in a lot of regards. And this is really challenging work, and it's gotten more challenging, which means that the skills of the people we hire need to be greater. So whether it's dealing with people who have more behavioral challenges or dealing with our aging population, because I think we can probably all agree that the population of people with intellectual and developmental disabilities is aging as healthcare has gotten better and their lifespan has grown, but their needs grow as well. So the work becomes harder. And as our workforce ages as well, that work becomes more challenging. So I think it's important to, recognize that the causes are really complicated and there won't be one simple solution to kind of resolve this. So there's a lot of impacts to the workforce shortage. There's a great impact on the direct service professionals that still work for us. So they basically are picking up the brunt of a 20% reduction, in my case, a 20% reduction in the number of DSPs. So how do we care for people and get the work done? They work a tremendous amount of overtime. What does that mean for people? What does that mean for their quality of life? What does that mean for their own, family needs? And it's very sad that it requires that kind of work to even give people a wage that's can help them survive, in Long Island or in New York. And I saw in the report that it says of our direct service professionals, 1 in 6 live in poverty, 53% rely on public assistance. And that's sad to me. These are people who are caring for the most vulnerable of our citizens, and they are not able to make a living wage. So that is definitely a part of the puzzle that we need to look at and address. And again, what's the impact of this on agencies and programs and services? Programs and services have closed, are operating at a lower capacity. It's unavoidable. For us in particular, we've been fortunate. We have not closed any group homes. We have not, reduced any of our residential programs, but we have reduced our day programs. When we closed for COVID and reopened, we only reopened at about 30%. Now we're up to about 50%. And the only reason that we cannot open to 100% is because we don't have enough staff. We don't have enough staff to staff the programs, and we don't have enough staff to transport people back and forth to the programs. Both of those are really significant issues for us. We also did close some programs that, well, they're not closed, they're just temporarily not operating, that were really important to families, like in-home respite services. Our supported employment programs, we can't find enough employment specialists or job coaches to provide support to people. So these programs are either operating at a lesser capacity or not operating at all. I do know that in our state, there have been some providers who have actually moved people around in group home settings to close a house, to be able to, shift staff around so that they could ensure that everybody's needs were being met. And there's a line in the report that I found so striking, because it actually says, when providers lack an adequate number of qualified DSPs, they're forced to prioritize the basic essential needs of people over other activities. That's a little bit of a paraphrase, and that's essentially the struggle that we're all facing as someone leading an organization who wants to lead an organization that's providing the best possible services for people, that's ensuring that people are accessing everything in their lives that they want, whether it be employment, recreation. To know that that's being limited because our workforce is limited is really problematic. It is the one thing that I think keeps lots of us leaders up at night. And part of the reason why I'm really grateful for, the case for inclusion, because we're able to bring these things to the forefront and have a conversation about how do we fix them. So new development, new residential programs, new day programs, other innovative services have largely been halted in a lot of places. And I know they have in our state. We just don't have enough staff. So there might be a new home that was built that's sitting there empty. People haven't moved in and they don't have enough staff to open that program. We may have individuals that are supposed to move out of programs. Like I have a children's residential program. I have young adults who have been there for 2-3 extra years at this point because the homes that they were supposed to move into can't open because there's not enough staff. And all of those one-to-one services, community rehabilitation and support and employment, and those things that happen largely on an individual basis are not happening to the extent that they could and should because of the staffing crisis. And from a quality perspective, when you think about staff turnover, and in our case, we use a lot of temporary staff as well, which is not ideal, but it's necessary to keep people safe. You're talking about people that don't have the same level of experience and training and experience with the particular individuals that they're working with. So that has a negative impact also. And in our quality assurance process or quality improvement process, we track goals and we're always trying to be better. And I'm sure most organizations are. But one of the feedback I always get when we're not achieving a goal in a certain quarter is we didn't have sufficient staffing. So we didn't get out in the community as much as we wanted because we didn't have sufficient staffing. So I think all of those are things that, we have to consider. And that's the impact on the service recipients, right? So they're getting less service. Some might be getting no service. They're definitely getting less individualized services as things tend to be more efficient in groups. They have less access to the community. And there is concern by families, I know, especially in our area, about a return to institutional care. So as we're talking about moving away from institutional care and knowing that that's not the right thing to do. I don't actually think that we're going to move in that direction, but there is that fear for families that if we can't get enough staff and things become even more of a crisis, that is one of the things that will be looked at. So I think that we have to think about how that plays out and what that means for us, because that is something that we should always be fighting against and moving forward to make sure that that does not happen. So again, what's the impact on families? So if you have an individual with a disability that lives at home with you and they're no longer attending day program, which is happening for 50% of the families that attend my day program, and I know lots of others, it means they may not be going to work because they may be caring for their individual. So the impact of this is real, not only just in our field, but how that expands beyond our field. What does that mean for families? What does that mean for our local economies if other people are pulled out of the workforce because now they're being caregivers for someone who may have been attending, some sort of another program? So those are all problematic. And I can give you cases. I mean, I have a young man whose family called me very recently and said he'd been working for 12 years. He was let go because of the pandemic. They weren't able to bring him back. And she's called 5 different agencies and no one has employment services for him. This is someone who clearly has a proven track record. He's been trying by himself with not a lot of success and really needs some employment supports. So those people are out there. And as we move towards trying to think about greater independence in the community, work is one of the greatest issues for people with disabilities. It is the one thing that gives people sort of social capital. It gives them resources and financial capital, but it also gives them social capital. So work for people with disabilities is essential. And we're concerned that we're seeing that not effectively happening, in part due to the pandemic, but also in part due to the fact that we do not have enough staff to be able to provide these really needed services. So the impact for us is huge. It's been continuing for a very long time. There are solutions, although I think it's going to take time, and I think we're going to move to talk about some of those solutions later in the presentation. And I'm really happy to be able to share our experience with you, and I'm glad I was able to be here. So thank you.
Thank you so much, Colleen. This report was a special report for a number of reasons. We focused on the data that was available to us, and then we moved from that data into solutions and opportunities for recommendations. But in that search for the data, we realized that there was a lot of data that we weren't seeing, and had an opportunity to emphasize that exists. So with that, I'm going to hand it over to James and Robert to discuss the interlude and a call for intersectional data.
Thank you, Lydia. Thank you so much. So I'll jump right into it. First of all, Colleen, really extraordinary, wonderful explanation of the problems that are being experienced on the front lines. And it really, really just sort of brings to life everything that's in the report. So thank you so much for your comments. I'm going to move with my conversation with Robert to really kind of focus on what is an intimately related topic. All of the things that you just heard about what's affecting the disability service professionals, support professionals world, and the challenges that they're facing just as a group overall, of course, are reflected in a number of sort of the unique characteristics of DSPs, and some of those are clearly connected to their demographic makeup. As I think Armando mentioned at the top, we're talking about a population that is overwhelmingly female. It depends on whose numbers you're looking at, but I've seen some numbers in some locations as high as 85, 87%. Many places it's in the upper 70s. We kind of use the number that's approximately 80% women. And then it happens that about 2/3 of all direct support professionals are people of color, the largest group being African American, somewhere around 1/3, a little bit more than that, than Latinos across the country, which are close to maybe 18, 19%, somewhere in that range. And Robert can correct me if I'm wrong there. And then a really fast growing number of DSPs who are immigrants. About 1 in 4 right now who are working in the field are immigrants. And those numbers are probably soft because, as we can imagine, in this kind of work, when it comes to essential workers, especially those folks who are going into people's homes, there may be a substantial population of undocumented immigrants who are doing this work. And those folks, of course, are extremely difficult to count. I give you those numbers in part to just to put into context, first, that these are workers who are facing all of the challenges that Colleen just described. And then on top of that are dealing with kind of very demographically specific sort of issues. And Robert and I will sort of dive into that in our discussion. Robert, if we could, I'd like to just go ahead and start by talk to me, first of all, about kind of the broader ramifications of this population being overwhelmingly female and certainly predominantly people of color as well. What are sort of the ripple effects of that reality in terms of the way they live and how they are able to do their jobs, or sometimes not be able to do their jobs?
Oh, I think I lost a little bit of my internet. Hi, James. Thank you for the question. I'm back. Yes. Thank you for the question, and thank you for inviting me to speak here today. I think what we know, and you mentioned some of these statistics, is that this is a workforce that's comprised primarily of women, of people of color, and immigrants, and for the most part are low-income workers. So they're also dealing with the challenges of being poor and low income in this country. And so what that means is that on top of all the challenges that these workers face because of poor job quality, the inadequate compensation, the limited training, the limited advancement opportunities, and just a general lack of recognition and respect for the critical role that they play, they're also facing unique and additional challenges. So if you take, for example, immigrants, both through research and also through our experience in the field, are also dealing with additional challenges with what it means to navigate our country's immigration system, which in many ways can be unwelcoming, even hostile. It can mean that their primary sources of support, family members, neighbors, et cetera, are also dealing with those challenges. And they might be dealing with cultural and linguistic incompetence in the areas in which they're working or where they're accessing supports. So it means that their lives are difficult at a time in which their jobs are difficult, which means that their ability to deliver these services is even harder. So I think that it just means that as we think as a sector what it means to support these workers, it means that in addition to improving these jobs, we also need to be thinking about addressing the profound inequities and disparities that they're facing.
And of course, if we think about where workers are located geographically in the country, these sort of demographic characteristics, it depends on where you are, right? So maybe if you're in the Northeast, we're talking about a predominantly African-American population. If you're in the Southwest, predominantly Latino, perhaps out in California. But one thing that seems to be pretty consistent across the board is that perhaps because of the pay scale and so on and so forth, it draws folks from communities of color. One of the things that I kept thinking about are sort of the practical kind of day-to-day limitations that may affect a low-income person of color who may be a single mom for that matter, and just the idea of that person getting to work or dealing with childcare questions. Explain to me why that may be more of an issue for some of these workers, as opposed to maybe if there happen to be working class, middle class, white DSPs who may not face some of those same challenges.
Sure. So, we did some research last month looking at disparities within the direct care workforce, looking specifically at race and gender disparities. And it did show that women of color were more likely to be parents of children age 18 and younger. Than anyone who's ever had to manage childcare, whether you're a direct care worker or not, knows that there's an incredible amount of responsibility and cost to that. If you're a single parent and you're working one or multiple jobs, as is the case with many direct care workers, the need for childcare, specifically affordable childcare, will be that much more profound. And yet, this isn't a sector that either through their employers or through the public offers access to affordable childcare. It also doesn't offer support for elder care, and many direct care workers are what we call sandwich caregivers. So they're supporting both their children and an aging loved one. And yet we do live in a country that doesn't unfortunately offer affordable long-term care either. And so it means that you're typically paying out of pocket, you're typically having to make impossible choices between paying for food, for rent, for childcare, and so on. And your ability to be, I think, successful on the job is going to be minimized because you're less likely to be really present if you're dealing with those kind of economic pressures.
Cultural competency, if we can use that phrase, if you have a large population of people from communities of color and women, and they're caring for a population that may not look like them necessarily, how does that factor in? What are the dynamics of that?
Yeah, so I think we see a few things. One is that, we argue in the long-term services and supports world that person-centered services and supports are the way to go, that we should be tailoring services and supports to people based on their individual needs and aspirations, and also their cultural and linguistic needs. So it should be providing supports that are relevant to their culture and that are in the language, their primary language. That should be the case for workers as well. I mean, workers also deserve worker-centered supports and cultural and linguistic supports. And too often, what we see in the field is that workers themselves may not be able to access the kind of workforce development resources that are available in their communities because they're not in the right language, they're not accessible to them for whatever reason. And that's a problem, right? If we want to create kind of a fully equitable workforce, we need to think about that. The other piece is that it's one thing to provide cultural and linguistic supports to workers, but in other instances, workers are dealing with outright discrimination and bias in their lives and on the job. If you take as one example, workers who are LGBTQ+, in many states, they are not protected on the job as LGBTQ+ people, and that means that they're susceptible to outright discrimination in the job, and of course that affects consumers as well. Or immigrants who are also dealing with increased hostility, people with disabilities who often who often receive that kind of treatment as well. So on one level, I think it's important for us to ensure that their supports are competent. And in another way, I think we need to make sure that discrimination and bias is reduced entirely.
And you raise a good point about the LGBT community. I think there was an example that you may have cited about a gentleman who was receiving care, needed a direct support professional in his life, but decided I should stay in the closet because I don't know who the next person through the door will be that will help me, given the high turnover rate, and whether that person is homophobic. And so that reality sort of comes to bear as well.
Absolutely. I mean, prior to PHI, I oversaw the National Advocacy Program for SAGE, which is a national organization focused on LGBTQ+ older adults. And we heard that story quite often, that people who had lived out as LGBTQ people often had to go back into the closet the minute they were needing services and supports from the community or entering a facility or an environment in that sense. The other piece is that on the plus side, I would say that SAGE also has an LGBTQ competence program that trains professionals on how to be more supportive of LGBT people. And what we had found and what SAGE found is that it wasn't only, it was supportive for the resident who was receiving who was living in those environments, but it was also supportive for workers who are in those environments, because if you're training an entire environment on what it means to be LGBTQ+, it will benefit the residents, but it'll benefit all staff who oftentimes are facing discrimination from their own colleagues. So this is one way in which we can address that.
Okay, and then just to close out, because I know we're running a tad long, can you talk about data? One of the reasons that I ventured into kind of this conversation, and I'm not a data scientist myself, most of my background is journalism, but one of the reasons I dove into this topic was because there just wasn't apparently a lot of data in the way that there might be on other categories. So what's the challenge there? How are you dealing with it at your institute? And feel free to also mention, I think you have an equity institute that you've created.
Yeah, absolutely. I mean, I think it's the data challenges exist on multiple levels. First, most states do not collect data on direct care or direct support professionals. They don't collect data that captures full-time and part-time staffing, vacancy rates, turnover rates, and so much more at a minimum. And without that data, in a moment like the COVID-19 crisis, when it first started, it was difficult for states to understand workforce capacity in certain regions of the state. Let's say a hotspot emerged in one area of the state, states would want to know, are there workers that are available in other parts? And the answer is we don't know, because states don't collect that data. There isn't a federal occupation code for direct support professionals, so that makes it impossible to accurately measure the percentage of DSPs and the level of support that people with IDD need. The other piece is that even when states are collecting data, they often aren't disaggregating data based on demographics, percentage of women, percentage of people of color, et cetera. And they're not looking at disparity data. So it's one thing to understand the diversity of the workforce. It's another to say, well, are people performing better or less better than their colleagues? And that's where disparity data can come in. We would be able to measure, for example, are immigrants in this workforce succeeding at the same level as their counterparts? Are LGBTQ+ people succeeding in the same level? We can suspect that they're not, based on just what we know about discrimination in our broader world. And yet, because of that lack of research equity within the workforce and proper data collection systems, we're not able to ascertain that. You mentioned our Equity Institute. PHI launched a Direct Care Worker Equity Institute last month, specifically to address this and many other issues. What are the disparities that workers are facing within the direct care workforce? And how can policymakers, how can practitioners, and how can researchers address that? We're looking forward to addressing that.
Robert, your wealth of knowledge. Thank you so much. You made this very painless. I appreciate it. I'm going to pass it back now to Lydia, and I appreciate all of the support that was given to me as I worked through this process by the folks I interviewed. Thank you so much.
Likewise. Thank you.
Thank you so much, James and Robert. We really appreciate your time. And now we're going to turn to part 2 of the report. I'm just going to pull my screen back up quickly. It's really easy going through part 1 and going through the interlude to become very frustrated and just hurt by the practical impact we're seeing in the communities. And it's easy to get bogged down that things are getting so difficult that it's hard to maintain that momentum to continue forward. But we do have hope. There is opportunity to turn these numbers around, to bring focus back to the home and community-based services and the direct support workforce. There's opportunity to gain more data, and there's opportunity to leverage the spotlight we have on our services now into sustainable solutions for the future. So the part 2 of the report really focuses on how do we take the infrastructure that we have now, how do we take the data that we have available to us and turn it into solutions. The COVID-19 pandemic, while devastating and continuing to increase the crisis of the direct workforce shortage, It also has brought, for the first time, real focus to home and community-based services, both in the historic investments that we've seen in funding through the Provider Relief Fund, through the American Rescue Plan Act, that highlight the needs for stability in the direct support workforce, but also the need to build out long-term solutions to home and community-based services infrastructure. And so what we've done with our part 2 of our report is review those investments that have been made already, review the momentum that we have, and then push specific recommendations for the Biden administration, Congress, states, providers, and advocates about how we take that momentum and drive it into sustainable solutions. So I'm just going to review some of those recommendations with you, those top line recommendations, and then I'm going to hand it off to Barry to talk about how do we take that as providers and advocates and move it into real action. So our recommendations for the Biden administration is to incentivize states to use federal funding to address each component of the workforce crisis. We certainly have seen opportunities for states to take advantage of federal funding, not least of which was the Families First Coronavirus Response Act, which included an approximately 6% FMAP increase for all Medicaid services. And then we saw that turned to ARPA with a 10% increase specifically for home and community-based services that states had an opportunity to apply for and create a spending plan to address home and community-based services. So certainly incentivizing states through those funding sources to address the workforce crisis. Include home and community-based services under the Equal Access Rule. Medicaid includes regulations that dictate the importance of keeping reimbursement rates high enough to enlist enough providers that people are able to access those services the same as they would if they were using private insurance. So including home and community-based services under the Equal Access Rule would allow CMS to better monitor reimbursement rates so that they wouldn't drop so low as to keep direct support professionals at low pay and make it difficult for providers to remain open. Robert talked a little bit about establishing a standard occupational classification, or a SOC, for DSPs through the U.S. Bureau of Labor Statistics. What a SOC would do is allow us to track that the data of wages in the occupational classification for DSPs. Currently, there's no SOC right now for DSPs. And not only does that make it difficult to gather data, but it also makes it difficult to advocate for increases in pay for DSPs as rates are reviewed and set each year. Not to suggest that those reimbursement rates are reviewed each year, but that the opportunity to review does exist. Recommendations for Congress: appropriate that funding to rebuild the DSP workforce as well as the broader HCBS infrastructure. So while we're recommending that the Biden administration incentivize states to use federal funding, Congress needs to appropriate that funding specific to the DSP workforce and the broader HCBS infrastructure. Prioritize funding to incentivize the development of DSP pipeline programs, anything to incentivize people back to our fields. Predicate state funding opportunities on commitments to review and adjust payment rates at least once every 3 years. That was something that we saw come out of the Better Care, Better Jobs Act, is a recommendation for states predicating their funding on at adjusting payment rates. Sometimes we see reimbursement rates that haven't been adjusted for decades at a time. Imagine trying to run a business and pay your workers off of costs that were appropriate in 2000. It makes it incredibly difficult to keep up with inflation, with new labor mandates, with new policy recommendations as your HCBS program changes and shifts to provide more person-centered care and support. Again, if the Biden administration doesn't establish a SOC, compel the Bureau of Labor Statistics to establish a SOC. Our recommendations for states are very in line with our recommendations for the administration and Congress. Each time that federal funding opportunity exists, target supports and services for individuals with IDD and focus spending plans on stabilizing the direct support workforce crisis. I think something that we found with the 10% FMAP increase in ARPA was certainly an address to support the workforce crisis, but because the funding was only available for 1 year, there was a reticence in increasing direct support professional wages, or providing any kind of adjustment to funding that would create a fiscal cliff at the end of that year, where states would have to make that funding up. And so we saw states have a sense of concern about providing those investments with a 1-year opportunity. And so as we look at federal funding opportunities in the future, certainly providing funding that incentivizes those long-term solutions, but also working with our states to target those funding opportunities into supports and services that would stabilize the direct support workforce, even if it's only for 1 year, but also encouraging states to invest long-term beyond any kind of short-term infusion that exists through federal funding. Absolutely adjust reimbursement rates in the immediate term, and then enact legislation or regulations to guarantee regularly recurring reimbursement rate reviews to ensure DSP wages are competitive against other industries. If you can imagine what other industries were paying and what was competitive in 2000, and attempting to use that same funding model to be competitive in 2022, we're likely to see just a continuation of the workforce crisis that we see now. So those recurring reimbursement rate reviews are critical, especially when we see what's happened with the COVID-19 pandemic and how fast industries can shift and change. With the start of the COVID-19 pandemic in 2020, what we saw was private industries able to pivot and offer increased wages, hazard pay. They were able to adjust the prices of their services in order to offer that higher wage that would attract people to remain in the workforce. Unfortunately, home and community-based services are beholden to reimbursement rates. And if that reimbursement rate does not change, then their ability to offer higher wages does not change. So what we also saw through this pandemic was how quickly the market can shift. And if your legislature or your state is not moving quickly to be able to adjust to meet those new market expectations, what we can see is what we saw in this last couple of years is an extreme dive as people leave this incredibly essential and critical work to work in convenience stores, work at fast food restaurants, and these other places that were able to pivot to offer, for example, $15 starting. Prioritize people with IDD and the community providers that support them in the distribution of tools for mitigating the risk of COVID-19, including vaccines and testing and PPE. While we would all really like to feel like we're shifting towards a sense of normalcy, the COVID-19 pandemic and the public health emergency is still active. It's still impacting services and individuals with intellectual and developmental disabilities at a disparate impact from the rest of the country. It's incredibly important that we continue to prioritize people with IDD and the providers that support them for anything that would mitigate that risk. So we list vaccines, testing, and PPE, but as we move forward and new opportunities develop to mitigate that risk, making sure that we're prioritizing people and providers to access those new testing and resource opportunities. So with that, I'm gonna shift to Barry to talk to us more about recommendations for providers and advocates.
Thank you so much, Lydia. I'm very excited to be here. As Lydia mentioned, I'm Barry Jardini, the Executive Director at the California Disability Services Association. And it's truly an honor to be presenting today in collaboration with the co-presenters, and just big thanks to UCP and ANCOR for this incredible report. And one of the things that I think Lydia was just speaking to that makes me so excited about this report and being here today is that the case for inclusion doesn't just spotlight problems, right? It does highlight real systemic and foundational problems, but it also pivots to focus on recommendations. How can we do better? How can we move the fight forward? How can we make people with intellectual and developmental disabilities, how can we make their lives better? And it actually gives you a blueprint wherever you are in the system, where you can make an impact. And it's also heartening to know that a lot of these recommendations are things that we're putting in place here in California. I know things are different in different states throughout the country. Not everyone is in this exact same situation, but I can tell you from being a part of the State Association Executives team here at ANCOR that, we are facing a lot of similar problems throughout the country. And so sometimes while it feels tiresome and that you might be fighting alone, note that there are many fighting alongside you, doing the same good work and trying to push for better throughout the country. And really once we build this sense of community and we build a focus on the challenges of our population here, and it's exactly what this Case for Inclusion report does, we have an opportunity to seize the moment and really try to make a difference, not only in the short term, but really to do some systemic transformation for the system that we're all passionate about serving. So I'm supposed to focus on what providers and advocates can do to make a difference, and I'm going to bring a couple of examples to bear that we have found in California. So much of what the report showed in terms of the challenges are reflected in what's happened here in California. So much of what Colleen spoke to, what's happening in Long Island, in New York, resonates here. 1 in 5 workers in California, DSP workers, is gone. From March 2020 to today, we have a workforce in crisis. We have a service access crisis, people who can't get the services that they need. And we have folks rationing services or not getting them at all. So all of those realities that are happening elsewhere are certainly happening out here, but we also have had some opportunities. And I think we've heard others speak to that as well, that give me hope for the future, both here in California and certainly nationwide as well. The first thing I will say is, pushing for every opportunity to draw down federal funding to help us through the pandemic has been absolutely critical in California. We've had leadership that have taken advantage of that. We have supported providers and community-based organizations to pursue some of the federal opportunities, but also we've had a state that has been, very forward-thinking and in trying to develop flexibilities for services to keep the system afloat during this pandemic. So while we couldn't do traditional services in all different modes, we developed an alternative services model that allowed for flexibilities for remote services, for virtual services. It wasn't always perfect. Some providers did quite well. Other services didn't quite meet the needs of the individuals that they were serving. But that flexibility and the focus for how can we keep things moving forward was really important. The reason that happened, partnership between the state, the federal government, certainly with the funding, but also advocates pushing for, this is what the system needs. This is how we can move forward through this difficult time and how we can hopefully keep a foundation that will allow us to build into the future. The other thing that we've really pushed on, and fortunately here in California, we're moving towards this, is pushing for reimbursements and rates that sustain a workforce reflecting the work that they do. It's impossible not to listen to everyone on this call and so many individuals in our space, and not just grow incredibly frustrated and weary that we have direct support professionals who aren't recognized for the professionals that they are, that they have to work in depressed wages, that we don't have rates that pay them adequately, that we are reliant on the states and federal government to fund rates at a level that allow us to pay DSPs what they're worth. I saw a couple of people in the chat talking about, what Target's paying, $24 an hour. That is certainly a far cry from where we are today in our system, but it should be an aspirational target. No pun intended, sorry about that, that we can push our wage levels to a level above minimum wage. We should not be talking about minimum wage for direct support professionals. So it's important that leaders in states and advocates really push on trying to raise reimbursement rates. I think I also saw a comment that bonuses are not the answer long-term. I couldn't agree more. We need foundational rates that provide a wage structure for DSPs to be paid fairly, to keep them out of poverty so that they don't have to work multiple jobs, rely on public benefits, et cetera, and give them an opportunity for a career advancement so that we have folks who can join our system, love the work that they're doing, and see a future for themselves in it. That only happens with sustainable rates, and it's important that we continue to push in every corner of the country to get to that point where we have rates that reflect the needs of the individuals and the services that are provided. I'm really heartened again by the focus on HCBS. Lee spoke to this. We haven't really ever had the focus on home and community-based services that has become apparent through the pandemic. So in every challenge, there is opportunity. And one opportunity here, and I certainly don't want to minimize the pain and the challenge of COVID, one opportunity that has arisen is that we have a spotlight now. We have an administration at the federal level that has shown some commitment to fund HCBS services. We've got a Congress that was close to getting us there and getting us a historic increase in HCBS funding. We need to push that across the line. That is going to apply broadly throughout the country. It will allow states to meet the needs of the individuals that they need to serve. It will allow advocates a platform to push on states to increase their funding, to draw down additional federal funds, to take us to a new transformative place. I know that things are tough. I know California is a little bit different maybe than everyone else. We have an entitlement system. Everyone here is entitled to services by law, but it doesn't mean that everyone gets what they need. We have waiting lists. We have people waiting for services, not getting what they need, rationed services, et cetera. But we do have, we can be a marker for what can be successful elsewhere. Advocates here have pushed for these rate increases. We have a 5-year plan now. It's not going to be enough. We're going to have to try to accelerate it. That's what we're doing now. But we are pushing really hard and working in partnership with our states and with other advocates, building coalitions to push for what we need to build a sustainable future. And that sustainable future could be beautiful. I mean, what keeps me going, and I think what keeps a lot of folks going, is the promise of better, building a system that doesn't look like the system we've had before, that is more outcomes-based, that is more inclusive, that is more person-centered, that really gets to the needs of the individuals with intellectual and developmental disabilities throughout this country. That's what drives us here, and I know drives so many others, and really now is an opportunity to try to capitalize on that bright future. It's weird to say that from a point of crisis, because the crisis has never been more acute, but that's our opportunity, right? To work together, to raise our collective voice. And I'm always proud to partner with ANCOR on the great work that they do at the federal level. Certainly supports what we do here at the state level. It's also great to connect with people throughout the country to know what everyone else is facing and everyone is pushing on. So today, if I can leave with anything, just raise your voice, connect with others, build community, build partnerships with the folks in your states. Leadership, I know it's not always a friendly relationship, but push on that, work on those relationships, because they will bear fruit. We've seen that here in California, and I know it can happen elsewhere as well. So I want to thank everyone for joining us today. I want to thank the ANCOR team for inviting me to speak, and happy to answer any questions that anyone has. Thank you so much, everyone.
Thank you so much, Barry. With that, we're going to enter our brief Q&A. I would invite all of our panelists to turn on their cameras if they'd like. I'm going to go through a couple of the Q&A and offer opportunities for people to jump in and add any thoughts that they might have. One of the questions I saw come up and also discussed in the chat was, what are the 5 states that have the most prominent waiting lists? I also saw some discussion about turnover, and we have rates that might be a much higher turnover, how states differ. And so I want to invite people to take a look at our website that has much more state-specific information. I'm gonna share just my screen quickly to demonstrate our website. So if you look here and go to data by issue, you can see all of the primary categories that we collect data in and draw our conclusions from. And each one of these issues has its own state-specific information if you dive into it deeper. So for example, if I wanted to find what are those top 5 states I could go to, reaching those in need, And what that will bring me to is all of the stated specific information that we have on waiting lists. And so if you look, for example, how long are waiting lists? We can look at the section ranking people on HCBS waiting list 2018, and that will show us Texas, Ohio, Louisiana, Florida, and Illinois, and where the waiting lists are at the time that we were able to collect the data. Similarly, if you go back to data by issue, I heard some discussion about the turnover. The specific citation that we shared was the median for the participating states in the data collection. But if we go to workforce and crisis, we can see the turnover rates by state, and some of those states, I believe, raised as high as an 80% turnover for the state. So really, you can see that where we are as a nation can really be impacted by where you are as a state. So I'll stop sharing there and just invite everybody to engage more in our website to look at some of that state-specific information. So I wanted to go to this question that I saw in the Q&A and also discussed a little bit more in the chat. I know it was state-specific about why providers might feel or direct support workforce might feel that $15 an hour is not an adequate solution to address the direct support workforce crisis as a whole or its impact on the HCBS infrastructure. So I was hoping to invite any of our panelists to speak a little bit more on that. Colleen, did you have thoughts? Or Robert, go ahead.
Yes, I'll step in for a second. So it's a great question. I mean, I think it's valid. I think what we see is that what we argue for in terms of the direct care workforce is a wage that's commensurate with their level of skill and experience, which is much higher than $15 an hour. In fact, if we think about the level of skill and the level of knowledge that's required to do this type of work in today's environment, dealing with the kind of clientele that we're seeing these days, it should be much higher. I mean, it's a real statement that these workers are not making a wage and a salary that's much higher. But the other reason is that when you look at from a competitive market standpoint, we did a study 2 years ago that looked at the median wages for direct care workers compared to occupations with similar or lower entry level requirements. And what we found was that in all 50 states plus DC, the median wage for direct care workers is actually lower than occupations with similar entry-level requirements. So I saw a comment that was pointing out that workers who are working in Target, I think in Long Island, were making $25 an hour, which is much lower than direct support professionals in that area. And that's true around the country. We often see that wages for industries like fast food and retail, as two examples, are often higher than wages in direct care. And that has to do in many ways with the financing behind this system, that oftentimes employers, whether you're a consumer or an agency, is relying on what the state is reimbursing and what the state is offering. And they're not able to compete with fast food. There are also hours that are sometimes more stable in fast food or retail. They're more reliable. They have access to sometimes better benefits and signing bonuses. So it's a real, it's an egregious statement about what we think about direct care workers and direct support professionals in today's environment, that somebody working at Target, which should be a good job in its own right, is making a lot more than workers in this sector. It's a really valid point that this person made.
Thank you, Robert. Colleen, did you have thoughts also?
Yeah, I was just going to say, I think it's not so much about pinning it to a specific dollar amount, because different parts of the country have different, living expenses. And I think it's more about, similar to what Robert said, it's more about the sense of where do these people fall in line with other jobs in the environment, and whether or not those are seen as requiring the same skill and ability. And would you make a choice, to work in, caring for someone when you have to dress and bathe and physically assist them, or you could just stock some shelves at Target. And I'm not minimizing that as a job, but when you have those choices and you're getting paid the same, you may make a different choice, where for years we've always had that little bit of a leg up, where we always had the ability to provide a little bit more than what was minimum wage. So I think that's important. And I also did see in the chat the compression issues. We talk about, and there's a lot of frustration when we talk just about direct service professionals. I think it's important to note that we do that because they are really the bulk of our employees. There's so many more of them than any other job title, but I also think that we do have to talk about what that means for the rest of the organization, nursing and other, rehab people, because we end up competing, on an unfair playing field for those positions as well.
Thank you so much. So we're coming to the end of our webinar time, and I want to just thank everybody for their time sharing with us. And I'd like to hand it over to Barbara Merrill to give us our closing remarks.
Thank you, Lydia. And I'm really sorry that we didn't actually have enough time to answer everyone's questions. I just want to thank everyone, though, for joining. It's been just a tremendous turnout. I always alternate between loving and loathing the role of being the last speaker. Loathing it because there's just never enough time to say everything that I want to say, but really, really loving it because it was my honor to listen to all the presenters today. You guys did just a tremendous job. So inspiring. I really want to thank everyone for the report. In particular, Lydia, Dawson, and James Garcia. Thank you so much, Sean Lichtefeld, for quarterbacking all of this. Robert, thank you so much for the work that PHI does. I'd just like to briefly echo Colleen's refrain of how sad is it that we're losing ground? What is this losing ground, going backwards? That's not something that the ANCOR Foundation or United Cerebral Palsy, UCP, has ever been all about. Just look at the tagline for UCP. It's life without limits. The ANCOR Foundation, ANCOR stands for the American Network of Community Options and Resources. We can't accept limits on the options that people with disabilities can exercise in the community. Barry, thank you so much. You were absolutely right. Yes, this is incredibly sobering. This is nothing less than a catastrophe, but this does present opportunity. We have never had the spotlight shown on the challenges of our direct support professional workforce more than ever. So this is our chance. That's why it's so imperative that the Biden administration, Congress, state governors and state legislatures across the country, all of you advocates, take action. And let me just really reiterate, what will it take? This is directly from the report. If you haven't downloaded it, if you haven't read it, I implore you to do it. And I implore you to share it widely. What will it take? It will take the Biden administration's providing guidance and consideration that prioritize funding and data collection to address the direct support professional workforce crisis. And yes, data collection that goes even deeper so we can fully understand the demographics specific to the DSP workforce. It will take Congress creating programs and pipelines like those proposed in the Build Back Better Act that create incentives for people to become direct support professionals and that further professionalize the workforce. And it will take every state government fully leveraging federal funding and flexibilities to begin rectifying the extraordinary damage done by decades of underinvestment in community services. And I continue to quote from the report, and it will take every one of us. So Sean, thank you so much. I loved that you put in the chat the importance of not losing hope. And so let me reiterate, among all of these actions, there is one to prioritize above all else, and it is to not lose hope. We have, it's your passion, it's your dedication. It is the extraordinary strength of all of us advocates working together that has forced the magnitude of this workforce crisis in the spotlight. Let's not lose this moment. I thank every one of you for signing on, but most of all, I thank you for your dedication and passion for improving the options and resources for individuals with disabilities. So thank you for joining on to our webinar. And please do not hesitate to reach out to any of us if you have any questions on how you can operationalize the recommendations included in this report. And lastly, thank you, Armando. It is our pleasure on behalf of the ANCOR Foundation and its director, Gabrielle Sidor, it is our honor to work with UCP. Thank you.